Hi, this is Riyaz. This is PARAMEDICOGENISIS. Today we have to learn about in this video the Propofol part 2 video. So already I posted part 1 video. Before watching that, don't miss that video. So in this video we have to learn about the systemic effects of the Propofol and clinical uses and adverse effect of the Propofol. Before start the session, let's intro. So first we have to learn about the systemic effect of the Propofol. In three main systems, Propofol what will act? In central nervous system, Propofol will decrease the cerebral blood flow, cerebral metabolic rate and cerebral consumption of oxygen and intracranial tension. Due to decrease these parameters, Propofol will used in second most drug choice for neurosurgical anesthesia. So what is the first drug used in neurosurgical anesthesia? It's a thiopentone sodium, because its thiopentone sodium also decreases the cerebral blood flow, cerebral metabolic rate, cerebral consumption of oxygen and intracranial tension, but it's preserved the CPP, that means cerebral perfusion pressure. In Propofol, it's not preserved the cerebral perfusion pressure, but it also decreased the all parameters. So its Propofol was used in second most drug used in neurosurgical anesthesia, and it also inhibits the, we'll already know that chemoreceptor trigger zone that's concerned for nausea and vomiting. So it produced decreased nausea and vomiting effect. In CNS, that effect also is that, and in CVS, that means cardiovascular system, it produced decreased BP, blood pressure, and decreased heart rate also, and it produced the venodilation. Due to decreased BP and heart rate, it's not used in patient with shock. So what is the drug used in induction agents used with shock? You have to post in comment section also. So next, it's a respiratory system. Propofol is the severe respiratory depression effect, and it produced depression in pharyngeal and laryngeal reflexes also. Due to depression of pharyngeal and laryngeal reflex, it have high chances for pulmonary aspiration. So Propofol was not used in RSI, that means rapid sequence intubation, and it have a bronchodilatory effect also. Now we have to learn about the clinical uses of Propofol. Propofol was commonly used as an induction agent. Already we know that as a dose of 2 to 2.5 mg per kg. Especially it's used in neurosurgical anesthesia. It's already we know that second drug choice for neurosurgical anesthesia and malignant hyperthermia. So Propofol was the induction agent choice for malignant hyperthermia, and it also choice for renal and liver impairment patient also. Because of, we already know that in first part of video, it's have a extra hepatic and extra renal metabolism. Due to have a extra renal and extra hepatic metabolism, Propofol is an induction agent choice for renal and liver impairment patient also. Not only Propofol used in induction agent, it's also used as a maintenance of anesthesia in intraoperative period as a Propofol infusion. It produced decreased BP and produced the bleeding related risks, decreased the bleeding related risks also, and it decreased the doses of muscle relaxants also in intraoperative period. And he used it as a day care surgery. Already we know that Propofol was a rapidly metabolized drug and no residual post-operative, no residual effect and less PON risk. So Propofol was used as a day care surgery and day care anesthesia also. And Propofol also used in ICU as a patient, it's a sedation. It helps to sedatory effect, so it's used in ICU sedation also. And Propofol as a treatment is a chemotherapy induced vomiting. So it have an anti-emetic effect, so it's treatment for chemotherapy induced vomiting also. About 10 to 15 mg IV, that means 1 to 2 cc IV, it's used to treat chemotherapy induced vomiting, and it have an anti-pruritic effect. So when used in neuroaxial anesthesia, that means spinal anesthesia, it's an adjuvant of opiates also used. Due to used in neuroaxial anesthesia opiates, it's produced most common complication is pruritus. So treatment of that pruritus, it's Propofol about 10 mg IV, that means 1 cc. So next we have to learn about the adverse effect of the Propofol. First one is the allergic reaction. We know that Propofol have a component of egg lecithin and soybean oil. A person with egg and soybean oil allergy, it's more prone to propofol allergy also. So a person with egg and soybean allergy, we have to relatively contraindication of the induction agent used in that patient also. And it have a pain on injection. Propofol have a preparation of soybean oil preparation. It's activate the kallikrein pathway. It produce the pain on injection. Already we know that as the first part of the video. So to prevent that, we have to new propofol called fast propofol. It's a water based solution. It not produce the pain on injection, not activate kallikrein pathway. But our conventional propofol, but compared to our conventional propofol, post propofol have a less potent effect. And third one is bacterial growth. Propofol have a egg lecithin component, so it's a high chance of bacterial contamination, especially E. coli and Pseudomonas aeruginosa. So prevent that, we have to use it. Open wire should be used within 6 hours. Already we know that. The hypotension is the most common complication. We already used the induction agent of the propofol, and it have a producing prolonged myoclonus is nothing but muscle jerks. The most potential complication of propofol is the propofol infusion syndrome, otherwise known as hyperlipidemic syndrome. Due to use this infusion more than 48 hours, it's produced failure of free fatty acid metabolism, and it inhibited the mitochondrial respiratory chain, and it's produced the lactic acidosis. So the complication, propofol will leads to cardiomyopathy. Propofol leads to produce cardiomyopathy, metabolic acidosis, and acute pancreatitis and skeletal myopathy. So it's a propofol infusion syndrome is the most complication, most potential complication, most potential adverse effect. So hope this video very clear about the induction agent of the propofol. We will meet the another video as soon as possible. Until then, signing off, Riyaskhan. This is PARAMEDICOGENISIS.